Hi, everyone. Welcome to today's Fill Up Your Cup session. Super excited to see some names who joined us 2 weeks ago for the first of this two-part series. And also even more exciting to see institutions that I've done some work with. I'm seeing Glenn County here. Hi, Allison. Say hi to Amanda for me. And then I'm seeing San Bernardino. Hi, Wendy. And so again, this is a two-part series. If you missed the one that we held on August 20th, I recommend that you check out this recording on our YouTube channel. In this session, this was when we dove, I shouldn't even say dive deep, we introduced, is more accurate, the concepts of what assets are, what a network is, and what asset and network mapping is and why it is useful. Today, we'll deep dive into just one use case and touch on something related to automating to reduce the upfront work in creating a asset or network map. And so before we dive deep into our objectives for today, again, Sue kind of alluded to this at the beginning of this call, but I just want to take a quick moment to share about an upcoming opportunity that connects directly to what we're going to be talking about today. At the end of the month on September 30th, we'll be hosting a interactive, as I like to call it, step one training. That's going to be about, getting hands-on with Kumu, which is the tool that I'll be using today. This session is designed to essentially help you move from whatever raw data you might have or whatever raw piece of information you might have, going through what I feel are the simple and easy steps of being able to format them and put them into a tool such as Kumu or maybe something else of your choice. And so, whether your focus is, advancing community health improvement plan, maybe you work in outbreak response and you are thinking about utilizing something like this for contact tracing, or just coordinating across some of the coalitions that you might be in, that step one training will essentially be for giving you the practical skills to be able to take it back onto your work. And so as we go through our very short 45-minute session today, really think of today as like sparking questions and ideas, and that training could be the next step in helping to build your own actionable network map. And so our concept of the day is strategy-based decision-making with network map. Our objective is to establish foundational concepts and demonstrate how mapping can support systems change. Today, we'll understand how mapping can help inform strategy. We'll walk through a map together to see how filters can help reveal insights on a live map. And then we'll go into some breakout rooms and explore scenarios and practice drawing conclusions and asking the right questions from the different views you'll all get to play around with today. And then we'll briefly chat at the end about identifying opportunities that you could apply mapping in your own work. And since everyone on the call today didn't get a chance to, as there wasn't a part of the first session, I figured we would just kind of reground and recap from what we talked about last time. And so, why mapping matters. One of the things I kept saying last time was, you can't coordinate what you cannot see. We also talked about different tools such as GIS, Google Maps, data dashboards, different network mapping software, and talked about how different tools can help you answer different kinds of questions. We also looked at a simple map that was a network map that was based out in Baltimore on environmental stewardship. And we kind of got to play around with that map just to kind of see how different organizations defined environmental stewardship and how that related to the kinds of projects that they were associated with. Today, we will be exploring some of California's Medi-Cal Cal-AIM context in our specific use case. And I'm going to say it again. You can't coordinate what you cannot see. And so again, before diving into the use case, I want to pause here on why we map again. Mapping is about making the invisible visible. You want to be able to see assets. Again, assets, for those who missed the last call, we defined as, they could be people, program supports, and essentially any resources in your ecosystem. And then you want to see how these assets are, how they fit into a network, which is essentially how these items are connected. This is how you really get to visualize and see and get that clarity for action, in my opinion. In the Cal-AIM space, this means for what we'll talk about today, understanding who's in the system. We'll talk about enhanced care management and community supports and how they connect. And without that visibility, I really feel like coordination becomes an uphill lift, it becomes a bit of a guessing work, and introducing network mapping into this ecosystem makes referrals and decision-making and coordination much easier. And so I want to start with a simple poll. You should see this launch on your screen out. There it is. And so before we dive into today's use case, we'd like to hear from you. Again, a network map can show many things: who's connected, who's missing, where the gaps are, and how the resources are flowing. I'm curious as to what do some of you on the call want to see on a network map? Your answers will be used to just inform some of our planning and some of the things that we offer as part of Phil Collective in the future. Great. I am seeing lots of responses on underutilized organizations or assets, lots of people selecting gaps in services or referrals, a lot on equity as well. I'll keep the poll open for just 5 more seconds to let everyone get a chance to answer briefly. Right. Share the results with you all. Hopefully you can all see that. You'll see that for most of the group attending today, what most people want to see on a network map is underutilized organizations or assets, followed by being able to see gaps in services or referrals, and then being able to see equity, who is included or who's missing. And so thank you all for answering that short poll. As you can see, network maps can answer a wide variety of questions depending on your perspective. Again, today we're going to focus on a very specific use case, which is enhanced care management and community support coordination in one county in California. And so I will walk through why our team built this map, what it shows about enhanced care management, or ECM for short, and community supports in Mendocino County, and how it sparked strategy and questions that the collaborative in this county utilized for coordinating care for ECM and community support beneficiaries. And so I know not everyone in the chat right now is from California, so I figured I'd give a brief background on the content before I jump into the mapping piece. And so the CalAIM Providing Access and Transforming Health Initiative is what I'll be focused on here today. We call it PATH for short. This is a 1.85 billion multi-year investment from 2022 to 2026, with the goal of creating infrastructure needed for enhanced care management and community supports to succeed and last. Community supports are cost-effective and medically appropriate services that address social drivers of health. Examples of community support services can include things like housing navigation services, medically tailored meals, sobering centers, and the list goes on. They're optional, flexible services that health plans can provide in lieu of traditional medical services. Enhanced care management provides whole person care coordination for Medi-Cal members with the most complex needs. People experiencing homelessness, high utilizers of care, emergency department users, children with complex conditions, and many others. ECM is essentially about making sure that care across providers and systems is integrated and really person-centered. And so PATH essentially helps fund the workforce, the data systems, and the cross-sector collaboration that's required to make ECM and community supports work. And more importantly, it's designed to ensure that these efforts are sustainable beyond the short-term funding of this initiative. And so jumping into the map that we built, this map was built at the request of Mendocino County's health department, who are the facilitators for their county's CalAIM collaborative. This helps provide a shared picture of their ECM community support system. Who are the providers? How do they connect through referrals and collaborations? And how can we utilize such a map to start to identify how new providers show up in that system so that they can be a part of the collaborative and support the county planning as well? Why did we build this map, given all the different resources that already exist? Well, to them, the system was too complex, given some of the different pieces of information across MCP directories that they were using to identify other providers. They felt that some of those things were not timely and accurate. Second, they wanted something that they could maintain locally versus something that was maintained by their health plans. Third, they wanted to be able to use it to simplify referring to each other because they lacked a closed loop referral system, and they wanted easier way to be able to go get some providers information without cold calling and spending hours on the internet trying to find contact information. Fourth, it allowed the collaborative to recognize, again, as I said, when new providers enter their system and helped inform outreach for inviting them to be active participants as part of their collaborative. And then lastly, it was automated and it helped reduce administrative burden on the health department in maintaining a local list. That was our why behind creating this map. And so something that I just very briefly touched on that I'll only very briefly still touch on is the automation piece. And I like to name this part because one of the things that we have heard many times in the past when doing network mapping trainings, whether it was for outbreak response or whether it's for something that I'm showing you today, one of the first barriers to entry that we usually hear is the manual labor of the upfront work and in the manual labor of trying to maintain such a map, especially if you're an organization that has a plethora of information that you're trying to map. To reduce this administrative burden, something that the field team is really into is automation. With the map that I will be showing you today, what we essentially did was we took the PDF document that the health department would send out to all the organizations, and then that they would manually aggregate into an Excel table afterwards. Yeah, very fun task for somebody. We put it in a Google form, the exact same information. They send it to the other providers in the county at the exact same cadence that they were previously sending them to, and they would complete this Google form. This Google form, of course, is linked to a Google Sheet. And the Google Sheet is, of course, what we linked to Kumu. That way, if you are provider, a specific ECM provider in that county, you complete the survey, the map at the end automatically updates with all your information. And so it really reduced the administrative burden and provided so much value in that sense as well. And so before that, I am going to now jump into the map. You got a preview of our breakout questions for later today. And so this is the Mendocino County CalAIM Collaborative Organization profiles. This is essentially the network map that I had a screenshot of that we are going to be exploring together today. I'm going to go find my chat. That way I can see if there are things in the chat as I walk through this. There should be a link in the chat now that one of my team members has put in for you to also follow along as I go through this. The first thing that I want to orient you to is when you get to this map, you might not have the same view as me. You might, like maybe it's blue, maybe it's green because you're zoomed in somewhere else. The first thing I will ask you to do is to zoom out. If you are using a mouse, that is using your scroll bar to zoom out. If you are using a PC, it is using your trackpad, which is typically 2 fingers pinching in or pinching out to zoom out. I want you to go find on this map where the nodes are, and there are only nodes in one group here. And so hover your mouse over where that is, and you will be able to zoom in on that cluster of dots, nodes that represent each organization in here. Once you are there, the next thing I'll orient you to is this left side of my screen right now, which is the information pane. In this information pane, we like to keep a high-level description of what is contained in this map. And so you'll see in the information pane that we have a very simple description of what this map contains. And then as you scroll down, we have a more detailed information in terms of how to use this map. I will demo some of that now, but for our breakout, I just really wanted to name this because as you all explore this map on yourself later in your breakout rooms, if you get stuck, the information pane will be there for you to see. If you are not seeing an information pane and yours looks something like what my screen looks like right now, I will orient you to the very far left of the map. You will see this 3 dots that are stacked upon each other. If you click it, your information pane will come back in case somehow it disappeared. Once again, that is the 3 dots on the far left side on the Kumu page. Your information pane will come back. And so here we put the details of what is on the map, how to drag around the map, what the nodes represent, what the lines represent, and I'll walk through that as well. For orienting yourself around the map to go from left to right, you simply click the map and drag it around. And so let's say I want to go see something more north in my map. I can click up here and drag down. If I want to go more south, I can click and drag up. Same thing for all directions. Again, I showed you how to zoom out with your scroll or your trackpad. These plus arrows in the top right also allow you to do that. You can click plus to zoom in or click minus multiple times to zoom in. At the top of my map here, yes, this webinar will be available for review because we are recording it and it will go on the Phil YouTube website. At the top of my map, you will see a lot of different options here. These are called controls in Kumu. These are essentially some of the different variables that are feeding into this map that I have made easier and accessible to be able to simplify filtering in my map. And so in this map right now, at the top row is one level of filters, which is what district these organizations provide services in. At the bottom, at the second row, you see community supports and you see enhanced care management. This is another filter for a variable for whether this provider provides community supports. And you'll see that now when I've clicked community supports, some of the organizations disappeared because now all that's left are community supports. If I click ECM, all those that are remaining are the ones that are ECM providers. Even under that, there's another control that is a dropdown, which I made a dropdown because of how long these options are. Had I made this similar to the controls at the top, you would see too many bubbles on here and it's just not visually pleasing. It's just another different variable that we can filter by, which is, which ECM population of focus do the organization serve? And similarly, which community support services do the organizations provide? At the very top of the map, the last thing I will orient you to before actually walking through the details of this map is essentially, you will see the name of this map, Mendocino County CalAIM Collaborative Organizations Profiles. But to the right, you'll see something that might say Mendocino County CalAIM Organization Profiles map. But I want you to click that drop down there and you'll see that we have different views. On this view, my map has changed colors. That's because on this view, I have different settings on. On this view, this is what I always call the default view of this specific map. I have color-coded these maps so that it is visually easy to tell who delivers community supports, who delivers just ECM, and who delivers both ECM and community supports, as notated by the legend in the bottom left. As I zoom in, you will start to see some of those differences. Blue is an organization that delivers just community supports. Red is an organization that is only contracted for, blue delivers just ECM, I apologize. Red is just community supports, and green is an organization that delivers both ECM and community support services. If you see an organization that's gray, that means that data doesn't exist from them in the data that is currently feeding this map. And so in this default view, you can use this kind of information to essentially come to this page and try to identify who a provider in this county is delivering specific services in this CalAIM initiative. Another really cool thing of Kumu here is the information for each node will pop up in the information pane if you click. And so, for example, let us click First Five Mendocino here. When I click First Five Mendocino here, you see that information's pane has pulled up. And essentially, this is all the data that we currently have for First Five Mendocino based on the last time that they responded to the survey. You can imagine that the utility of this map now becomes as a on-the-ground provider. If you are referring patients in this county, this is one way where you can go identify who else is in your network, who else is operating in a system, what services are they delivering under CalAIM ECM, what districts do they provide these services in, what percent occupied is their ECM capacity. You could even get their referral links on here, and you have the contact person of who you may want to call to help better coordinate patient referral between your organization and their organization. That's just one use case here. You can click as many organizations in there as you want to. Another use case here could be simply, you maybe have a very trusted organization that you typically refer to. Let's just say I'm someone who typically refers to Mendocino community health clinics. They are at capacity, but I want to refer to someone that they have experience working with. I can come to this map and hover my mouse over Mendocino Community Health Clinics and see who else they are connected to. And maybe that's something that I want to prioritize of, okay, maybe I'll reach out to Anderson Valley Health Center instead, but I see that they only deliver ECM and not community supports. Let me go back and hover over them. Maybe there's another community supports organization that they're connected to. I see that they were connected to Vision Family Resource Center. Maybe this is who I'll outreach, who I want to send or refer my patients to for receiving specific community health, community support services. And that's just the information that you can get from just this view that I'm showing you. You can create as many views as you want in Kumu with the same data. On the same map, I will go to a different view here called ECM referral capacity. You'll see that my legend has changed. I have the exact same data that's sitting in Kumu right now, but I created a view that was at the request of our providers in this county, where they wanted to come here and be able to visually see, okay, who has capacity to accept new patients under ECM. On this one, you'll see that it is color-coded intentionally green, red, yellow. Green being they have less than 30% of their ECM capacity occupied. Red being they have 70% of their capacity, over 70% of their capacity occupied. And so the visual colors here really represent, being able to come here and recognize that I can refer to Serene Health because they have much more capacity over an organization such as Redwood Community Services for ECM supports. I can see that Anderson Valley Health Center also has between 30 and 70% ECM capacity, and so forth. And so this map has really become a care coordination tool for the providers who deliver ECM and community supports in Mendocino County. Similarly, we have another view specific for community support referrals. This is essentially the exact same thing that I just showed before, but now it's color-coded by their community support capacity. And so this really becomes a really actionable tool for providers in coordinating referrals. It's particularly helpful in regions that don't have a closed loop referral systems. Another thing that I want to leave here before I move on to our breakout room is essentially one thing that this map turned into that it was not part of the original use case was it became an avenue for the health departments and other providers in this county's ECM Community Support Collaborative to invite organization types that were seeming to be left out or not fully integrated into the network of care. And so something that had happened here is, for example, you will see that Pinolville Pomo Nation is now on this map, but there's no data for them. This organization, which is a tribal entity, was added to this map because one of the other organizations responded to the survey and said, oh, I've sent patients to this organization under ECM or community support. While there's no information in here for these organizations at this point, this has now become a tool for trust building. Now the collaborative can identify which of the other organizations in their collaborative sent a patient referral to this tribal nation and are able to use this to try to form relationships with the tribal nation, invite them more into the collaborative planning so that all the players, all the triggers, all the individuals who are playing some kind of role in the ECM community support space in Mendocino County are starting to meet together at that table so that they can better, more holistically, comprehensively coordinate care for ECM community supports for all patient populations in the county. That was one of my favorite use cases that came out of this. 2 weeks ago, one of the things that I said is like a network map really helps you with asking the right question. And that was one of the questions that came up here in our first review of the map with the providers of, oh, what do we want to do with the organizations that we don't see their data in? And it was starting to use this from a more collaborative planning setting. And so it turned from not just being something of being able to find information on providers delivering services, it then turned into something that allowed people to be able to use this for relationship building among those who are delivering these services in their county. there's a lot more that I could go through on this map, but we only have 45 minutes today. And so I just wanted to show that really high level picture of, one example that we've developed with some of our partners in California. I hope this really does a job of really piquing some of your interest in some of the different ways that we can incorporate asset and network mapping in some of your work. And so now I want to go into breakout rooms and put this map into practice. I showed how to basically maneuver around the map. Again, we'll put the instructions in the chat as well. But I would love for you all to consider one of these two questions in your breakout room. Really interact with the map and think about what you see. The additional sub questions there are just prompts. You are okay to explore additional questions that come to mind as you are interacting with this map. The second question is, where can you act, or what's popping up to you about things that you're interested in based on where you are seeing networks, connections, or lack of connections, and what strategies you could implement to fill some of those gaps. And so Cassandra will now put you all in a breakout room till 1:35 p.m.
Maybe a little, I think we're a little over, so maybe a couple minutes more.
1:37 Pacific
Yeah.
time, you will be in a breakout room. And then we'll come back into this main room and just kind of share some of the things that we saw, some of the questions we had before we close out today. Mm-hmm. Going to our first poll. When you explored the map, what stood out the most? What did you see? Cassandra's going to put a poll in the chat now. Again, I recognize that all the options that we have in there may not encompass all the different diversities of perspectives that are in the room. And so if you have something that you saw that wasn't one of the options that we put, I encourage you to share it in the chat, or just, come off of mute and briefly, verbally let us know what you saw. I'm seeing that a lot of people noticed the highly connected hubs. That is one of the first things that came out to us when we developed the first pilot of this map when working with the providers. I'll leave the poll open for a few more seconds just so everyone gets a chance to answer. Wendy, your hand is up.
Hold on. I know I always have questions to ask. I noticed right away that a lot of these organizations are outside of Mendocino County. And so right away I'm thinking, because this is CalAIM, right? And it's really tied to a specific, managed care within Mendocino County. So I'm wondering, does other managed care in other county that is also, where the organization lie, also able to have those access? So that's just kind of a question that I have.
Yeah, so this one was developed specifically for Mendocino, but some of those counties, some of those organizations that you're seeing are contracted in multiple counties as well. And so their physical address, as they're geographically mapped on the map you saw, is where their physical offices are located. But they're included in this map because they're part of the Mendocino County CalAIM Collaborative and are contracted with Partnership Health Plan to deliver services in Mendocino. Hopefully that answers that question. Let's not get too sidebarred here.
Yeah, that's really interesting. And there's so many utilizations for that as well. So
yeah. Okay. And so if you can all see some of the results that I've shared here, it seemed like most of those who responded to the survey, what they noticed were the presence of a few highly connected hubs, such as some of the larger hospitals who are typically responsible for sending referrals to some of the other organizations. Others need a bit more time to draw their conclusions, which is totally okay. There's a lot of information in that map, and I went through it in 10 minutes. Most of my map presentations are 30 to 50-minute long presentations, not 10 minutes. And this was just done with the intent of just getting you interested. And again, we provided the link so you can explore on your own as well. But now that you have gotten the chance to walk through a map, I am curious for those on the call who, again, you all come from very different locations and different contexts. If you had a map like this for your work, what would you want it to show? What would you be mapping? Would you be mapping connections like we did here? Would you be mapping for gaps in referrals? would you be mapping funding? I had a really fun conversation in my breakout room where someone shared something that was actually not an option here as well. And so I'm curious to see, to hear more about what some of you will be mapping. Funding is coming up here.
I love
And
that. That's
if
so
it's something
interesting.
else, please put it
Yeah.
in the chat or share it verbally.
Hmm. Hmm.
Yep. I will end the poll now and share results just for time's sake. And so you see that most of what people are interested in mappings are, how funding or resources flow through their system, but the other 25% interested in how which organizations are underutilized assets. And so again, this is just really kind of showing that you can use mapping to show so many things. In my breakout room, it came up that, someone wanted to use this for mapping individuals across organizations and thought that Kumu is not something that you could use for that. And I just want to say, you can use it for that too. What I showed today is just very truly tip of the iceberg network mapping with Kumu. I showed a system of organizations that are referring patients among each other. You can show how people or organizations are connected by the type of work they do, by the funding resources they do, how individuals are connected inside your organization, how individuals are connected outside of your organization, how individuals are connected across organizations based on the different work that they've done over the last 5, 10, 15, however many years. Essentially, network mapping at the end of the day, if you can think of something that is an asset, and you can think of something in terms of how they are connected, you can create a network map from it, whether your tool of choice is Gephi or Kumu. Of course, what I showed today was Kumu because we feel like it is the easiest to use. It's got the lowest barrier to entry. The base version of it is free. They have a very comprehensive resource guide for all the questions that you'll ever have as you are starting to utilize Kumu. And so I just wanted to name that as we wrap up today's session. I really want to highlight, the next step in this series, which is our From Data to Action Mapping to Mobilize training. Again, this is a step 1 training happening on September 30th, 11 to 1:30 Pacific Standard Time. This one is designed to help you move raw data into a mapping platform and help you start generating insights like some of the ones that we explored today. We put the QR code on the screen so that you can scan it to just learn a bit more or register it if you feel that you are ready to. And also as a thank you for being part of the Fill Collective and joining our Fill Up Your Cup series. We're also offering a $10 discount for this upcoming training as well. When you register, you can just use the code Fill Up Your Cup to receive the discount. We'd love to see you there. I think it's a great opportunity to go deeper into building your own map and strategizing your data. We only went through a very, very tiny amount of information on the map today. And I just showed a few views and some of the different things you can use that for. That could be used for so many more things across so many different use cases. Also, in addition to this discount, those who register for the September 30th training will will also receive a Kumu 20% discount. And so if you join this training, we've partnered with Kumu because there is a paid version of Kumu that gives you a lot more in terms of having private maps instead of public maps. You can add all of your logos. You can get some utilization statistics, so the number of times people view your map, the number of times people interact with it, and a lot more of that Google Analytics that does become really helpful in evaluating the utility of a map that you developed. And so that will come as part of the training as well. And then lastly, I'm asking a lot from all of you. As we wrap up today, we'd love to hear how today went for you. Please take a moment to respond to this quick poll. Your feedback is really, really important to us and really helps us improve these Fill Up Your Cup sessions so that we make them a lot more useful for people's work. The ones in the past 2 sessions were related to asset mapping, but your feedback today still helps us inform some of our future series that might be related to other things, just so that we ensure that people who are joining us for 45 minutes are making the most and enjoying their time here. And so I would appreciate if you could just stay on for a couple more minutes to complete these for us. And thank you to those who are completing the survey. We sincerely appreciate it.
So Jan has her hand up. I know we're over, but Jan.
Yes.
If you wouldn't